conducting system of the heart. Where is the SA node located? SA node is located in the upper posterior wall of the right atrium below the opening of the superior vena cava. And where is AV node located? AV node is located at the interatrial septum. What's the position of the AV node? AV node is subendocardial at the posterior inferior right atrium at the apex of the triangle of the cock. It's unlike the SA node, which is epicardial, as in the upper posterior wall of the right atrium below the superior vena cava. But AV node is at the posterior inferior right atrium at the apex of the triangle of Koch. From the SA node, the impulse goes to 2 points. Number 1, it directly stimulates atria, and number 2, impulse goes from SA node to the AV node, and from the AV node to the bundle of His, to the ventricles. AV node is the only connection between the atria and a ventricle for the conduction of the impulse. This is the SA node, AV node, bundle of His, dividing into 2 right and left bundles. From the AV node, the conducting tissue, it traverses the bundle of His and then the right bundle and then the left bundle branch. Where is anterior fasciculus and posterior fasciculus of the connecting system? Anterior and posterior fasciculus both arise from the left bundle. This is the left bundle. This is the right, left posterior fasciculus and the anterior fasciculus arising from the left bundle. The right bundle branch traverses the right ventricle and then through the Purkinje tissue supplies the right ventricle. Left bundle branch traverses the left ventricular septum and then Purkinje tissue too supplies to the left ventricle. How the AV node is connected to the SA node? There are 3 internodal pathways that connects the SA node to the AV node: anterior Bachmann, middle Wenckebach's, and posterior Thorel. SA node and 3 connections between the SA node and the AV node: anterior Bachmann, Wenckebach's, and posterior Thorel. What is the nerve supply to the SA node? Sympathetic nerves are from T1 to T4, and the parasympathetic supply for the SA node is from right vagus, and for the AV node is from the left vagus. Why? Because SA node develops from the right side of the body and the AV node develops from the left side of the body. How is the vagus inhibitory to the heart? It increases the potassium conductance and decreases the calcium permeability. That is why it's inhibitory to the heart, slows down the heart. What happens to the impulse in the AV node? The impulse in the AV node delays. How long it delays? It delays for 0.1 second. And what's the speed of conduction in the AV node? It's 0.05 meters per second. Where in the conducting system the speed of conduction is slowest? That is the AV node, where the speed of conduction is slowest, is 0.05 meter per second. Where in the conducting system the speed of conduction fastest? The speed of conduction is fastest in the Purkinje tissue and it is 4 meter per second. So there is a difference of speed in the AV node and Purkinje tissue of about 80. How does the impulse is spread? It is spread from endocardial to the epicardial surface. What is the first part to be depolarized? It is the left side of the interventricular septum and then the apex. And what is the last part to be depolarized? Last part to be depolarized is base of the left ventricle and upper part of the septum. Why the impulse delays at the AV node? What is the purpose of the delay? Impulse delays at the AV node because the size of the node is small, and number 2, there are fewer gap junctions that delays the impulse. And why does it delay? The delay is to perform the ventricular filling. Ventricular filling completes because of that delay at the AV node. Why the AV node is prone to injury or subject to injury? AV node continues as a bundle of His and is in close proximity to the mitral, tricuspid and aortic annuli. Therefore, it's subject to injury. What is the effect of coronary artery disease on the conduction? Block may be temporary or permanent in case of a coronary artery disease, especially with the right coronary artery, affects about 10 to 25% of the patient, and it causes most commonly first and second degree block or the permanent AV block also. So which type of MI causes which type of blockage? It is the inferior MI which causes more commonly the block, and it causes second degree and higher proximal block. The lower the block is, the more dangerous it is. So the anterior MI causes more dangerous block because it blocks the distal AV node bundle or bundle branches. So the lower block or the distal block causes wide QRS, which gives you worse prognosis and high mortality. Inferior MI just causes a block, and that block is proximal. Whereas the block is not that common with anterior MI, but it's more dangerous because it causes distal AV block, bundle of his. That leads to the wide QRS complex. So wide QRS complex are a feature of distal AV nodal block or that of the bundle of his. Now what are the etiologies of AV conduction diseases? Reversible and irreversible. What are the reversible causes? Autonomic, number 1. Carotid sinus hypersensitivity and vasovagal stimulation. What's vasovagal stimulation? And what's the difference between vasovagal and vagal stimulation? Causes bradycardia only and involves the parasympathetic system. The vasovagal response involves both sympathetic and parasympathetic. It causes bradycardia and vasodilatation. And what's vasodepressor syncope? In vasodepressor syncope, there is sympathetic withdrawal only. Second endocrine cause, reversible hypothyroidism and adrenal insufficiency. Amongst the metabolic causes, hyperkalemia and hypermagnesemia. Drugs that cause reversible conduction disorders are ABCD mnemonics, adenosine, antiarrhythmics type 1 and type 3, beta blockers, calcium blockers, and digoxin. What is the effect of the vagal tone in sleep? Increased vagal tone during the sleep may cause all types of block. Carotid sinus hypersensitivity, vasovagal syncope, micturition, cough. All of them may cause AV nodal block. Irreversible causes of the block. Disorders that cause structural changes, damage, and fibrosis in the AV node will cause irreversible block. These include number 1, infections. Amongst the infection, important is Lyme disease, which involves heart in 50% of cases and 10% of cases cause block. Chagas disease in Latin America cause blocks. The other infections are syphilis and tuberculosis. Second cause of block, irreversible, is infiltration in tumors, sarcoid, amyloid, and hemochromatosis, lymphoma, radiation therapy, and surgical ablation may cause permanent blockage. Muscle dystrophies like myotonic dystrophies, congenital heart diseases, overriding of the great vessel, ASD and VSD. What about the junctional rhythm in young individuals? In young healthy individuals, the junctional rhythm is benign and does not need any treatment. What's the effect of aging on the conductive tissue? In aging, there is degenerative changes in the ventricular septum causing block.